Hi, my name is Amelia Correa.
My name is Inez Flores.
And I'm Casey Miyashima.
And we'll be talking about phonomotor therapy.
Deficits in word retrieval are common in aphasic patients, which can also be referred to as anomia. Phonomotor therapy focuses on making word retrieval more automatic by focusing at the level of individual phonemes and phoneme sequences. That's because it's been found that focusing treatment at the level of the phonologic processor, meaning phonemes and phoneme sequences, it is possible to improve naming simply by increasing the opportunity for naming via the phonological route.
Phonomotor therapy is a multimodal, phonologically based program designed to train phonemes and phoneme sequences in spoken language tasks before transitioning to written language tasks. Phonology is the focus of treatment, and some of the goals of treatment are to improve phonological knowledge and phonological sequence, generalization to untrained targets, maintenance of trained and untrained targets.
Okay, three key factors to consider when you're performing phonomotor therapy. The first is phonological awareness and phonological sequence knowledge. Phonological awareness meaning their ability to detect similarities and differences, the number of sounds in words, as well as the ability to manipulate sounds in a word to make new words. Phonological sequence knowledge are the implicit rules which govern the order and pattern of sounds and syllables and words. Socratic questioning, which is systematic questioning of patients' performance so that they can independently detect the way sounds are represented and detect whether production needs repair from those errors. And finally, training multimodally, meaning that each phoneme has information distributed across visual, acoustic, orthographic, motor, and tactile kinesthetic domains. Visually, you can show them a picture of a mouth picture representing the sound. The patient can look at you or themselves in a mirror when producing the sound. Acoustically, pointing to a mouth picture that represents the sound after they hear it. Orthographically, showing patient letters and doing exercises for sound and letter matching. Motorically, have the patient repeat after you, and tactile or kinesthetically, have the patient explore how sounds are made, how the sounds feel, are they noisy, quiet, is the tongue tapping, being raised, etc.
The materials needed are going to be a small mirror. You're also going to need line drawings or photographs of mouth postures for phoneme productions, and this is going to include icons for voice and voiceless consonants, which are also known as noisy and quiet icons, which will be explained later. You're going to need letter tiles. You're also going to need small colored blocks for phoneme separation and felt colored squares representing syllables, and also a dry erase board and markers.
To start therapy, we do pre-practice. Before any of the sounds are introduced, provide a brief explanation of how the treatment works. For example, draw how areas work together. Producing sounds involves talking with the mouth and lips, listening and understanding through auditory, letters, and vision. Drawing a roadmap can help show the patients the program's purpose of strengthening the connections between modalities.
Okay, the first phase of phonomotor therapy involves practicing phonemes in isolation. We begin with consonants and then move on to vowels later. You use mouth pictures to train phonemes. We teach clients motor description of the target, such as the top and bottom lip come together in the production of P or P. Perceptual discrimination between phonemes. For example, are P and B the same or different? Production of the target, repeat after me, P. And grapheme to phoneme correspondence. What sound does this letter make after showing a picture of a letter?
Now we're going to look more into depth on the steps of phase 1. Something to keep in mind that these steps should be followed based on the patient's level and needs. The first step is going to involve consonants are introduced as cognate pairs using mouth pictures, voicing icons, the clinician's model, and Socratic questioning. Letters are not introduced at this stage just yet. So basically the consonants are going to be organized or introduced by place or manner of articulation and grouped according to their tactile kinesthetic properties. So first, sounds made with lips are going to come before sounds made with the tongue, then follow sounds with different kinds of air. Also, there's going to be an additional category titled Other Category, which is going to include tongue lifters, nasals, and windy sounds. Second step is you're going to encourage the patient to explore how the sounds are made and reinforce that knowledge through multiple modalities. So, for example, you're going to use Socratic questioning to have the patient describe what the articulators do to produce the sound, recast the patient's motor description. You're also going to use the mirror for visual feedback of articulator movement, and you're going to have the patient repeat the sound following an acoustic model.
Step 3, after you introduce the voiceless sound, you immediately introduce the voice cognate. You'll use this strategy for all voice cognate pairs in the lips, tongue, and air categories. Step 4, voicing distinctions are taught using icons and the terms quiet for voiceless sounds versus noisy for voice sounds. Voicing distinctions are also trained using tactile kinesthetic knowledge. If appropriate, you may have the patient touch your throat to feel the vibration of voice sounds and then have them touch their own throat. Step 6, after all the consonant sounds have been introduced, then you'll move on to teach the vowels using lip placement and jaw height. Say a sound, and I want you to first watch me and listen to me, but don't say anything yet, okay?
Okay.
What is my mouth doing?
It's closed and then it opens.
Good. So first, my mouth is closed and then pops back open and air comes out. All right, and then now I want you to check yourself in the mirror, saying the sound. Does it sound the same as mine?
I think so, yes.
Yeah. And then do we look the same?
Yes.
Yeah, our lips are coming together and then popping back open. I want you to give me 5. Good.
Now the second phase of phonomotor therapy. We move on from phonemes in isolation to phoneme sequences. You continue strengthening phase 1 phoneme production, but then increase phoneme production to 1, 2, and 3 syllable phoneme sequences in both non-words and real words.
The detailed steps of phase 2 are, first one is have the client break down how many syllables are in the word or non-word presented. Use felt squares to visually represent syllables. So for example, you're going to ask your patient, how many beats are in rainbow? You're going to model by clapping your hands or tapping on the table to break down the syllables. You're going to place 2 different colored felt squares to represent each syllable. After syllable breakdown, focus on one syllable and have client break down number of sounds in that syllable. Place sound blocks on top of the corresponding felt square for each individual phoneme. The treatment task of phase 2 will be similar to that of phase 1, but will now incorporate multisyllabic words and non-words.
So now that we've already worked on your sounds by themselves and sounds in just 1 syllable words, we're going to make it a little bit harder and do 2 syllable words. So first I want to practice the beats that we practiced earlier. So all of our words earlier were 1 vowel. That means it was only 1 beat. Like dog, dog has 1 beat in it, dog. So now we're going to listen to words that have more than 1 beat. So I'm going to start with action, 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 action. How many beats do you hear?
Action, action, action.
2 beats, good job. So we're going to use these little felt squares to represent our beats. Action, 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 okay? So now that we're breaking it down, we're going to focus on, to make it a little easier, we're going to just focus on 1 syllable at a time. So we have ack, ack, ack. Can you say ack, ack, ack? Good job. I want you to look in the mirror while you're saying it.
Ack, ack, ack.
Does your ack look like my ack? Ack.
Ack. Yes.
Yeah, good job. Does it sound like my ack? Ack.
Ack. Yes.
Good job. What do you feel when you're saying ack?
My mouth open, and then my tongue hits
to back.
Right? So your mouth is opening when you're saying ah, and then your tongue is moving back and making a k sound. So ack. So we're going to use these little blocks to represent our sounds. We have ah, k, ah, k, and we're going to blend them together. Ack, ack. Does that make sense? Mm-hmm. Yeah? Okay, so now we have our first beat, ack. Now we're going to work on the second. Action, action. So now we're just doing shun.
Phonomotor therapy is based on Dell's two-level interactive model of language. By strengthening the phonological level representations, both bottom-up and top-down processing is enhanced through bidirectional spread of activation. Through phonomotor therapy, weak phonological representations become stronger and easier to access when a word is activated. This results in an improved production of the word. Learning occurs when the adjustments of strength and connections between nodes take place.
There are multiple studies that have investigated the efficacy of phonomotor therapy on improving the word-finding abilities of patients with aphasia. Their results have found that phonomotor therapy was effective in improving trained sounds, generalizing to untrained sounds, confrontation naming, and phonological processing, as well as reading of non-words and real words. The MedBridge website mentions that the current research for phonomotor therapy's efficacy is based on an intense dosage. It was 60 hours a week for over six weeks. Future research needs to investigate more clinically feasible doses of treatment. However, clinicians may use the available evidence to determine if their client is appropriate for phonomotor therapy. We've also attached some links to some videos to offer more in-depth instruction on how to perform phonomotor therapy.
Hope you enjoyed the video.